Day 20 is here. Today, we're going to do the whole full routine of strengthening the mini squats, deep squats, the pranks, the lunges, and some stretches. The full routine. At least you know them, we have done them, and you are getting used to them. And because you know that, I just want to teach you something which should help us to maintain our spine, how we should sit, how we should lift things, and how we should sleep. Yeah. So I'm seated. So when you're sitting, we always say sit 90 degrees on the seat, either in an office seat or sofa set at home or any other seat. We advise your buttocks to be at the edge of the seat. Edge of the seat. You feel they are at the edge and then you sit upright. Once you make your buttocks at the edge of the seat, it assumes the 90 degrees. But if you're not, it's not at the end, which we are used, and sometimes we lean on, you are straining the spine and you're putting more pressure on the lower back, and you might find your back pain not going away because you are using the wrong posture. So always make sure your buttocks are at the end of the seat, be it a sofa set, office seat, or any other seat. It will always help you to gain that 90 degrees. Okay, I believe we have understood that one. The other one is when we are lifting something, we should always use our hips and knees to lift. Let's assume I want to pick my dumbbell, it's down there. I want to pick it, so I should use my hips and knees to lift it. So I make a step forward, I bend my knees and my hips, then I pick. This is what most of the time we do. You just go. Your knees are straight, your hips are straight, your spine is bent as a C, and that one makes the back pain never go. So always make sure you bend your knees and hips to pick anything on ground and pick. Even if it's a baby, let's assume this is my baby. I have to bend my knees, my hips, and lift up my baby. Okay? Let's assume it's a carton. I still have to bend my knees and hips and lift. Let's assume it's on that other side and I'm a little bit far. I put a step forward, bend my knees, my hips, and lift. And should be close to my body. Okay? Those are small things which makes our spine not to behave, because we do these things every day and we end up hurting our spine. So lifting, use your hips and knees. Sitting, always make sure your buttocks are at the edge of the seat. When sleeping at night, you love sleeping facing up. There's no problem. So when you are sleeping facing up, or we call it supine, you use one pillow on your head and the other pillow under your knees, like this. It is a must to sleep facing up. That's how you should sleep. Okay? But most of the time we advise you sleep on side. So side, you sleep on side like a fetus, like a baby inside mother's womb, like this. This is the best sleeping position. You make your spine rest. But if you are not able to do the fetus position, you can still bend your knees and then put one pillow under the knees and just sleep. Make yourself comfortable. The pillow should be soft enough, not too hard and not too soft. And sometimes we hurt our shoulders when you're sleeping because we keep our shoulders above the head, or we call them externally rotated or internally rotated. So I usually advise put your hands on the chest, just like this. You find they are very neutral, so you don't arch your shoulders. If it's a must to sleep on your tummy, still have a pillow on your head, and the other pillow, put it under the tummy. All these positions, they make the spine rest, just like that. Day 20. See you the last day. Check your list, tick you have done day 20, and see you tomorrow.